Hello, everyone. My name is Jenna Groman. I'm the Director of Global Communities of Practice at SAVE and Vaccine Institute. And it's my pleasure to welcome you to today's event, which will be an open discussion on funding opportunities to establish mass vaccination sites. Next slide, MJ. Just a few logistics for today's meeting. As we give everyone a moment to join, please share your name, your organization, where you're joining from in the chat. During today's session, we encourage you to share questions for panelists using the chat feature. Please do mute yourself when not speaking to limit background noise and feedback. But we also hope to have some open discussion throughout today's session. So please either share your thoughts and questions in the chat or raise your hand if you'd like to unmute and speak to share your experience and questions when we get to the discussion section. Next slide. Today's event is hosted by the Boost community and Ariadne Labs. Boost is a global community where immunization professionals connect, learn, and lead. If you're not already a member, we hope you join at boostcommunity.org. Next slide. The Global Mass Vaccination Site Collaborative is a new initiative. It's led, as I noted, by the Boost community and Ariadne Labs. And we're aimed at providing resources, accessible tools, and experts that are available to assist with mass vaccination site operations. The collaborative is offering an open access website, as well as a learning group on the Boost community as a community of practice. And this is a place where you can access resources, tools, events related to mass vaccination rollouts, and talk with your peers who are also working through some of the same challenges as you are. So we hope that you join the learning group and explore our website to learn more and see what we can offer and how we can work together on these topics. Next slide. So I'll actually go back, I apologize. Today's session, I just want to introduce, is the first of a bi-weekly conversation series. We really targeted a small cohort of professionals working on mass vaccination and high volume sites. And I just wanted to introduce the series because through these conversations, we'll be exploring a lot of topics around mass vaccination sites, such as funding, establishing and managing sites, monitoring and evaluation, and so on. So we hope you continue to join us every other week as we discuss topics that are really top of your mind and look at exploring tools, SMEs, resources that you need, and think about how we can help you further as we adapt and create more tools and toolkits to help you establish mass vaccination sites in your countries. So today's event in particular is focused specifically on funding. We're following up on our event last week, which we'll talk more about in a little bit. And we'll be talking about possible avenues to advocate to your national government for mass vaccination site funding. We'll be sharing experiences as to how you've addressed funding needs in your own countries, asking questions of peers, and then also talking a little bit at the end about what else you need as you move forward in this journey and how we can help share some other expertise and resources as we move forward. Next slide. So before we begin today, we'd like to just ask two poll questions. This is really to help us understand who is here today and guide our conversations and the resources that we can bring to the table. So these, I think, will pop up on your screen in a moment. Hopefully you can see them. The first poll question is specifically related to what level you were working at. We talked quite a bit last week about GAVI's COVID-19 vaccine delivery support, or CDS, which is limited to national level stakeholders. So we want to know where you fall. Are you a national level? Do you work at the national level, subnational level, or other?
And we'll just give it maybe another 15 seconds if you haven't answered already. And the poll results are being shared right now.
I cannot see them. Are you able to share it?
Yeah, sure. So we have 25% of folks joining us today from the subnational level and about 75% from CSOs, INGOs, and other multilateral, bilateral institutions.
Perfect, thank you. So if we can move to the next slide and second question, have you considered applying for funding to establish a mass vaccination site in your country? And that's just a quick yes or no. So we'll give that a few moments for everyone to answer.
Great. So we have about 25% saying yes, they have considered applying for funding, and about 75% that have said no.
Great. Thank you, Liz. And now if we move on to the next slide, I'm going to hand it over to Jen Seiler to introduce today's panelists and give a quick recap from our last session as well.
Great. Thanks, Jenna. Good morning, good afternoon, good evening, everyone. Thank you for joining us. Today, we're going to have Dr. Imran Mirza present again. He spoke last Friday as well to share a little bit more, to answer some of your questions from last week's conversation and get into a little bit more detail around kind of what is the framework you need to set up a mass vaccination site, and a little bit more about should you be considering one. We are also joined this morning by Robert Kanwagi of GAVI, as well as Ula Griffiths of UNICEF. Ula will also be presenting a little bit more on some financing opportunities and just giving you a broader picture of kind of within your country, who are the core donors. So last week, we looked a lot at the CDS platform, which is hosted by GAVI and COVAX, but also looking a little bit more broadly about potentially other avenues for funding to help execute on mass vaccination sites. So next slide. Next slide, please. So just doing a quick recap of last Friday's session. GAVI CDS funding opportunity, really thankful for Imran and Mona who joined us last Friday. Just kind of the overall recap is that the kind of CDS platform is designed to support countries to cover their funding gaps through the end of 2022. You can utilize this mechanism both for short-term and full-term request funding. And so the short-term funding is for urgent delivery needs that put COVAX doses at risk, and the longer-term piece takes a little bit longer for them to approve, but also speaks a little bit more to kind of mid-long-term plans and funding that you may need. Currently, and it looks like for the folks who are on the line today, perhaps the CDS platform is not accessible to you as it's only kind of available to select representatives within the national level Ministry of Health. But just for your awareness, I think today we'll also touch a bit on how can you advocate to your national level government for a mass vaccination site, and really start to understand if there are ways to kind of tap into that mechanism through your country's representative. There's also, we chatted about kind of the HSS health system strengthening funds that GAVI also makes available. That is something that I think the national level government would know to access, but that's another place in which a country could go for funding for mass vaccination sites. There's a little bit more on GAVI CDS guidelines explaining the eligibility criteria for funding, and we can actually pop that link directly into the chat now. And a note that the same application is used for both a request for short-term and mid-long-term funding. For folks in conflict countries, there's also another mechanism to support some of these efforts, and that link is at the bottom on the humanitarian buffer platform. So we'll also throw that link into the chat. Today, we'll have Imran speak, and then Ula, and then we want to open it up to more questions around this topic, but also beyond. So this is our first session that we're having that really focuses on you all in country, and wanted to have, I'm glad we have kind of an intimate group this morning to really understand what are you grappling with. So even the poll that we saw, 25% of you have either thought about applying or have started doing maybe mass vaccination sites, and 75% no. So those 75% no, I imagine, are interested in this topic for reasons of potentially wanting to get to the place where they're looking into this. And so want to also open up the conversation after we have our presentations to, questions around those presentations, but then opening it up to you to say, how can we help you? What do you need? What types of experts would you like access to? And we can also share a bit more about the resources that we have available on our new website. So with that, next slide, please, MJ. So I'm going to hand it over to Imran from UNICEF to take us through a few slides. Imran, over to you.
Thanks, Jen. Good morning, good afternoon, good evening, colleagues, for where you're joining. So I'm Imran Mirza from UNICEF. So I shared some of the slides in the last session. I will just go a bit more in detail today, but not still too much, because we will having follow-up sessions also, so we can work out further. Next slide, please. So before establishing any mass vaccination centers, we need to keep in mind some of the key principles. One thing is one size does not fit all. We know in immunization sector, there are different delivery strategies. And those delivery strategies will depend upon the population demographics, geography, needs, operational resources, what are required, what is the COVID positivity rate, how much vaccine is available, and what is the size of the target population. So different delivery strategies can be considered based on those things. For countries also can have a multiple delivery strategies, countries or even the geographical areas depending on the population needs. You cannot have a one delivery strategies for each country or one location. You can have a multiple delivery strategies even in the same location, depending how you want to reach, because your main objective of all of us is to reach each and every person with a COVID vaccine. And program managers will need to devise non-traditional and novel immunization strategies also, because there are some known, and then based on your local conditions, people will know much more better how they can reach which population, target populations, high-risk populations. But so it's not that it is one thing is crafted on stone that, no, this is the only strategy. You can do that one. But main focus should be on maximizing the utilization, minimizing wastage of the vaccine and the resources, and systematically track, monitor, incorporate equity into your design and your selection of the strategy. So that's a major thing. We know that all the strategies have the enablers, and so that has to be considered what will be required. And also for this address the pandemic is a huge undertaking. We will need a public-private partnerships wherever is possible or available is best to do the partnerships where the private sector can support or the public sector can support or both can work, because governments cannot do everything. They will need a support of the private sector. So wherever we can have any kind of support in any sense from the private sector, corporates, businesses, local businesses, or even local CSOs, NGOs, it is very important. Next slide, please. So as I mentioned, there are the different delivery strategies. And if you have seen the guidance developed by the WHO, we normally say that we have a fixed sites and temporary sites. Fixed sites are normally hospitals, health facilities. Temporary sites are normally outreaches when the team goes in the communities, they do the outreaches, or in the campaigns as a community pop-ups. For the COVAX vaccine, we have as a part of the fixed sites, there are two more. One is a mass immunization centers or the sites, and is a drive-through site. Some countries are doing the drive-through sites that people does not want to go to the health facility. They go in their car. There's an open space parking area where the vaccine is available. They keep sitting in their car and they get the vaccine while they are in the car and they just drive through. So that is one mechanism, but it's not available in all the countries, depending some of the countries established. Mass immunization centers or mass vaccination centers, if we are going to discuss a little bit more in detail, is a place where you can, is a big fixed site, temporary fixed site for limited time of period, where you can vaccinate 500,000, 2,000, 3,000 people per day, depending on the population, target population, depending on the demand, and depending on your resources. Normally in the health facility hospitals, normally in those places, we vaccinate 500, 100, 200 people maximum per day. So this is especially only for those sites. Next slide, please. So as I mentioned in the elders, I'm not going to details. It will take so much time, but while deciding on any strategy, you need to consider what are the human resources will be required, what will be the management, how you are going to manage the human resources additional, what will be the appointing schedule, because if you're establishing any strategy and you want vaccine, you need to know how much people will be required, what are the doses are required, whether the people are there to reduce your wastage. Planning and logistics, you need to consider how your vaccine will be arrived, so there should not be any stockouts, how the monitoring will be done, how if frequency, if the people are changing, number of people changing, how you are going to change the delivery. Communication strategy, you cannot vaccinate people without the demand and telling the people where to get the vaccine and when and where. So that's very important on that one. Plus communication strategy also addresses any of the risk communication, like if they are, we always know that for everything we get the rumors. So you need to address the rumors, otherwise people will lose trust on the vaccine. Strategic partnerships, if you need any partnerships with any private sector, any CSOs, third parties for anything, for like, for example, venues, if you want to establish a mass vaccine site, you don't have to construct a new building for that one. You can do a partnership with any hotel or conference center or marriage hall, wedding hall, any other shopping mall to use their underground parking or any big space. So that you will need a partnership for the venue. Or if you need any partnership for your logistics, that someone can help you in distributing your supplies or operations, or you can have a partnership for your security concerns or any other thing. So that's the partnership will be required. Next slide, please. For considering for coordinated planning for delivery, there's some planning considerations and there's some coordination groups. Planning was that you need to update your micro plans, your budgets and everything, distribution plans, what will be your cold chain, transportation, social mobilization, and sites which can be utilized for the available doses. Coordination, whole of the COVID response is linked with the national plans. We cannot run our own COVID vaccination plan. It should be part of the national deployment vaccine plans. So at the national level, it has to be approved by the NITEX are approving, ICC approving programs, logistics. So it has to be coordinating with everyone because it will be a joint effort by everyone. Next slide, please. So it's just a sample of the scenario of the mass vaccination center. For example, if you want to establish a center, so you will first identify what is your how much is your target population. Number one, as I mentioned in the last week, it is much more appropriate to have these mass vaccination centers in the urban areas where there's a big population. Having this mass vaccination center as a smaller rural area will not be cost effective or economical because you have such a small number of people to be vaccinated. So for example, if you want to do 60 vaccinations per station, how many you want? So when you are doing the calculations, you say patients per hour and by type of staff. So time to validate patient information that the patient comes, you will take 3 minutes, time to vaccinate around 6 minutes, sanitize the station because you know the COVID, you have to sanitize the seat where the whoever the person is coming and sitting and leaving. So not to spread if the person, because you will not know that person is infected was already or not. So 3 minutes, changing gloves for the vaccinators, 1 minute different. So you will consider how much. So approximately, if you say that it will take 10 minutes for the whole process and 6 minutes per shot, then you also consider number of flow lines. What are the maximum number of stations? That also ensures proper distancing. Station means the number of desks where you will be providing vaccine. So if you want to establish 6 stations, means you will have minimum 6 vaccinators at a proper distance. So you will be running 6 vaccinations at the same time. Will there be a special line for individuals with mobility issues, senior citizens? You have to consider because you may have people who will coming on the wheelchairs or seniors who cannot walk a lot. So you need to consider how you are going to address them. You can help them. What will be the mix between the experienced and inexperienced people? When we say experienced, inexperienced, experienced are the trained vaccinators or the trained health workers. Inexperienced, you can get immediate support for any admin work or any support for the lines, queuing or security and those things. Utilization, does the supply limitations limit with the daily volume? Time to take new staff to get up to speed, because you may have to getting a new staff every week or second week. So how much time they will need to be trained or be active and providing those services. Can scheduling reduce unproductive staff time between the patients, right? So for example, if you are considering the 60 vaccinations per station per hour, per shift, so means you will need 16 vaccination stations in a site, one vaccinator for 2 stations. If you can have one vaccinator for per station is very good. But we know in many countries we don't have so many vaccinators. So maximum you can have a one vaccinator, 2 sites who will be moving between the 2 desks to give the vaccine. And 2 shifts, what we are saying is one is the morning and the afternoon shift. The advantage of the morning and afternoon shift, that people who work in the morning, who are in the offices or in the businesses, they may not be able to come in the morning shift. So if you have a afternoon shift or evening shift, they will have access to that time and they can come at that time. So that's why we're saying that at least there should be a 2 shifts in the morning and the afternoon, so people can come whenever they can come. And 2 shifts we mentioned is 6 hours each, like 8 a.m. to 2 p.m. and 2 p.m. to 8 p.m. And you can vaccinate, then you can calculate how many people you can vaccinate. So you can see approximately 1,000, 2,000 people per day. And then depending on the hours and the number of the people, you can change those ones. Next slide, please. Yeah, that was my slide, the last one. So while when you are considering to have in mass vaccination, you have to consider all those things. It's not like we just think, oh, we want to establish the mass vaccine site and we just do it. You have to plan very well. You have to thought for that one, how you are going to do that one, how many people required, and that will help you in planning your budget also. Because establishing a site is one thing, and then maintaining and running the site is another thing. So on those all enablers and thinking, you will be able to, it will help you to decide how much cost it will take and how much funds you will require. Thank you. So over to Jen, over to you for the poll questions. Great.
Thank you so much, Imran. And I just wanted to share that I think a lot of the content you have here, and I know we culled down from a much broader set of content that you've pulled together. The team will work to make some of these into tools that could easily be accessible and usable by folks on the line. We will also be sharing these slides out with everyone who's joined us today. So just for your awareness, why don't we move to perhaps if there's any specific questions for Imran, you can save them or we could ask them now. So while we're doing this poll question, if you do have questions, please raise your hand and or please put the questions in the chat. But while we ruminate a little bit, let's do our poll question number 3. Have you advocated for funding in the past? Yes or no? Just give it 15 to 20 seconds to let you answer. Liz.
Yes, great. So the poll results have come in. It looks like about 60% of folks have said yes, they have advocated for funding in the past, and about 40% have said no.
Fantastic. We can talk more about that in a little bit. Any questions for Imran that have come up now? I don't think I see any hands raised. All right, then I will kick it over to Ula Griffiths, who will take us through a short presentation highlighting, again, more about kind of the potential funding opportunities and landscape across many of your countries. Ula, over to you.
Yeah, thanks a lot, Jen. Yes, so I'm Ula Griffiths from UNICEF in New York, and some of my colleagues who are involved in this work are also on the line, Nick and Ronki. So we have for the past year gathered information about what donors are contributing to COVID-19 vaccine delivery. So we are not gathering data on donors paying for the vaccines, vaccine procurement. It's really only the delivery part, which is relevant to this, what we're talking about today. So I'm just gonna, next slide, please. So we call this database C19VFM, which stands for COVID-19 Vaccine Financial Monitoring. So the database is designed to monitor external resources available. So it's really only donor funding. We would like to, but it's very hard to get hold of to find out how much governments are paying. But for the moment, it's just external resources we are looking at. And you can all get access to this database. It's just in Excel, and it might be helpful for you because it's data by country. So for instance, Nigeria, you could go in and see what donors are contributing for COVID-19 vaccine delivery in Nigeria, for instance. So it could be helpful. So you just have to email Nick on this email address, and then he'll give you access. Next slide. So I won't get into these details, but it's really just to say where we are getting the data from. It's publicly available, and then it's a little UNICEF centered because, of course, we have access to everything that's channeled through UNICEF. We also have the GAVI information, and then we are reaching out to donors via networks to make it as complete as possible. Next slide. So here you can see we have 27 financing sources captured within C19VFM. So we have the banks as well. So many countries have taken loans or getting grants from World Bank, Asian Development Bank, Inter-American Development Bank, both to buy the vaccines and also for delivery. So we are capturing this. GAVI has a number of windows. You know about the CDS. Then we have the bilaterals that you can see listed there. JICA, Czech Republic, USAID. USAID is the biggest donor for COVID-19 vaccine delivery. And we have some foundations, Bill and Melinda Gates, ELMA, and we have the EU as well. And then we have UNICEF under this. We have something we call the Humanitarian Action for Children, where a lot of private donors are contributing, which we then channel through UNICEF country offices. Next slide. So at the moment, $2.48 billion has been granted just to deliver the vaccines. A lot of this are some of the World Bank loans. They are a big proportion of this, which I'll show you, because it's a lot of money, as you can see. And we have 131 countries captured in the database. And here you can see them according to UNICEF regions. I'm not sure you're familiar with our regions, but Vicaro is Pacific. No, Vicaro is West Africa, sorry, is West African region. So you can see 23 countries in West Africa are in the database getting funding. Next slide. Okay, so here, this is what I mentioned to you before. A big proportion of this 2.44 billion are the multilateral development banks. So 57% are those loans or grants from the banks. And then bilaterals, 19%, GAVI 15%, foundations 3%, and other international organizations, UNICEF and the EU, 6%. Yeah, and you can see on the right-hand side, the number of countries. So you can see it's really a lot of countries receiving this funding. So bilaterals, they reach 124 countries. Next slide. So here we are looking at, on the right-hand side is quite interesting. You can see the funding according to per capita when we make some assumptions about how many, 70% coverage rate. So for instance, you can see a small country like Comoros is getting $15 per capita in external funding, and then Eritrea only 10 cents. So there's a big difference. I mean, some of the island nations, for instance, are getting a lot of money per capita. Next slide. Right, so this is just showing you how the database look like. And this is again, this analysis of per capita that we are doing. Next slide, won't go into Right, I think this is the last slide. We have recently published a report where we are looking at the funding gaps. So we're trying to estimate how much it will cost to reach 70% of the population in the countries, and then comparing that cost to what we know of has been allocated. Of course, we need to remember, I showed you it was 2.4 billion. A lot of these funds have already been spent. So we're also making assumptions on that. You can't spend money twice, right? So I don't know. I mean, I'm not sure how helpful this is for you, but at least I just wanted to show that there are many donors in the space, and perhaps in the discussion we can talk about how you could get access to some of this funding. I think that was it. Thank you.
Thank you, Ulla. I'm going to open it up to see if there are any questions. And I think this was extremely helpful. Ulla, will are you comfortable sharing these with us that we can share them out with the rest of the community?
Of course, definitely. Yeah.
Great. And I guess maybe to land on your last point. Oh, I think we have a question from Theodros. Theodros, are you able to unmute yourself?
Okay, good morning, good afternoon, everyone. I'm Tedros from Menaro office, regional office. First, thank you so much for your all presentations. It's clear, comprehensive, and informative. Thank you. Regards to mass establishment of mass vaccination center, from our side, we discussed in the office at regional office level, and started to advocate the country office to apply for the this opportunity. But I want to be clear about some important issues, maybe just to push countries, especially countries of concern, like Syria, Sudan, Djibouti, those with low vaccine coverage. If they have established such mass vaccination centers, there will be advantages in boosting the vaccine uptake. So my 2 points for discussion maybe. The first one, I understood they are expected to apply through CDS either the short-term or full-term request. Still, what I like to be clear about is, do they apply for a specific activity just to establish this mass vaccination center, or linking with other activities? The reason why I raise this is, some countries have already received some funding, CDS funding, especially 5 AMC countries. So in their activities, some of them have some kind of activities related with mass vaccination and the campaign related activities. If these countries apply for a specific mass vaccination center, is it possible? Or since they received some funding through CDS, if they want to be request again for this mass vaccination center establishment, is it possible to apply through CDS funding, through short-term or?
Theodros, did you say, are the countries you mentioned, are they the ones managed by UNICEF or by GAVI? You know that UNICEF manages.
Yeah, what I mean is UNICEF. But
yeah, so,
as you know.
So you know, we have no more funding. There's no more CDS funding at UNICEF. It's all been allocated now.
Okay, for the GAVI eligible countries, still they are in process. Only one country, Syria, applied for that. We are waiting the approval. The others are in a process. But my question is, do they apply for a specific mass vaccination establishment, or should be integrated with other vaccine delivery activities? Okay, which one is good or advantageous for them?
Yeah, so I won't answer this and go to GAVI because, as you know, your countries have already applied. There's no more opportunity, but I'm sure they can spend some of the funding we've just transferred to them for mass vaccination as part of what they do. But I can talk to you about, that bilaterally. If there's one country you think they're going to do something different than what they planned for, it'll be fine. Yeah.
Yes, thanks, Tedros. Yes, I think as mentioned by Ula, there are two things. If it is a GAVI funded country, like they already have the CDS money, what they can do is that they can, the colleagues can discuss with the senior country manager of GAVI and see the possibility. Your first question is, as I mentioned, all the delivery strategies should be part of the national plan. So it is a kind of delivery strategy. So if now, before country was not considering to establish a mass site, but now they think that they need to establish, so means they may need additional money, or they may need to reprogram their available funds, what they already have. So for that one, they need to discuss with SCMs, and most likely GAVI will give the approval, or GAVI may give the additional funds. Or if, so that's from the GAVI side. For the non-GAVI countries, if the government decides that it is part of their non-national strategy that they want to establish, so they can also look for other funding sources if the GAVI is not there, other bilateral donors, and almost in all the countries, the donors are available to support also. So, but your question was, it should be a specific, there is no specific funds for the mass vaccine sites for the donors, because this is a part of the overall national deployment plan. So this should be a one part of the strategy of the national.
Great, thank you guys. And I guess just to clarify that if you are indeed a GAVI country and your country's already gone to the CDS platform, accessed and received funding, short-term funding from CDS, the only way to re-access that would be to talk directly with your senior country manager at GAVI to understand if additional funding may be available in the short term. Is that accurate, Imran?
Sorry, can you repeat your question, please?
Sorry, yeah, maybe
Sorry.
just to clarify, I think it's like also if the country's already gone to CDS for short-term needs, but then learns about additional short-term needs from a local, subnational district, the only way to kind of re-access, if a country's already applied for CDS short-term funding, the only way to re-access that platform would be to speak directly with the senior country manager in GAVI.
Yes.
To speak about, okay.
Yeah, because as the demand is coming up, the more vaccines are coming up, and we still have a lot of countries with less coverage. So of course, to reach those populations, they need additional funds. So they can discuss if they want to change their strategy, they want more funding, they can discuss with the SCMs, and SCMs can advise them.
Okay, yeah. Fantastic.
Thanks.
Thanks for your question, Tedros. A couple of questions in the chat, and also feel welcome to raise your hand and speak live, but from Ebola, we have, how do you bridge the funding access gap and inequities in terms of access through community or subnational level financial institutions? Ula or Imran, I don't know, who would like to maybe take this question?
Yeah, it's a tricky one. I don't know. I think anybody on the call could try and help with this one. Because when you say financial institutions, I mean, do you mean private banks or? I think so. So what you're really asking is whether, if you're at a subnational level, how can you access? I can see we all go, and especially in a big country like Nigeria, I can see it's a big problem that all our funding go to the national level, because we know how funds to flow down is really troublesome. I wonder if some of the donors, like for instance, I know Bill and Melinda Gates are big in Nigeria, even USAID, perhaps they could give directly to states, because I can see that this is a big problem, but I'm afraid I'm not an expert in it. I don't know if anybody else on the call are. Please raise your hand. Yeah.
Emmanuel, I don't know if you have a question or if you wanted to add to that point.
Yeah. Yeah, thank you for the opportunity. One, I'm trying to, it should be a question I'm trying to add up and probably give another light on the Nigerian context, because the issue of funding in Nigeria becomes is a serious issue. So all fund comes through the federal government, that's through the national level. So it is from the national level, then it's been distributed to the state level, and from the state directly to the district levels or to the mass vaccination sites. Now you have a lot of issues around there. One, if there could be delay in those funding supports. Another one, there could be some interest groups, probably the CBOs or CDIs, and then probably private health facilities who are interested to go into support of the mass vaccination is not there, because to access those kind of funds rarely don't go through other organizations except government agencies. So there's a disconnect in that kind of a process. So except probably we need to look at it and try to see how you can be able to refashion how those funds can be assessed generally to CVS and probably other interest groups, so that to scale up the mass vaccination. And as we can know, some people prefer private health facilities to access health services. So whatever it is, they prefer to go to private health facilities. And then those private health facilities are actually franchised right from the first stage. It was just during the second phase that yes, they have been involved, which is good. But then funding support is actually suboptimal to those ones. So it's a point to ponder and look at probably other time of probably funding gaps should be addressed. And I'm sure that's just my point that I needed to add. Thank you for the opportunity. And I'm out.
Yeah, Emmanuel, it's a great point. Thank you. And Dr. Edbola, I like Ula said, this is a big question, and one that I think from our perspective, we would like to bring back up also to some of the leadership. You know, Gates Foundation has funded this community of practice, and there is there's a high level of awareness from the Gates Foundation and others around kind of what we are talking about within this community of practice. So can also translate that question back up to help us understand how can we do a better job. And I think Emmanuel, to some of your points, of also creating awareness of where there are gaps, desires, needs, demand for these kinds of interventions. So Ula, I see that your hand is up. Please
I just wondered if perhaps NGOs should have a role here. You know, perhaps that is the way, because I guess they have systems set up to channel funds to where they're needed. I'm just thinking of international NGOs. Perhaps that's what we should focus more on, to rely on in this situation. Wonder.
Absolutely. So in that case, Ula, would that be also folks at a more local level advocating to kind of different NGOs?
Yes, perhaps approach big NGOs in the country, you know, to see if then they can get access to funding that then can be channeled down. That's what I'm thinking. Yeah. Okay.
Yeah. Great idea. I think next question, Dr. Imran. I know that, fantastic. Would love to also hear more about your experience with 100+ mass vaccination centers. So maybe you could even open up the floor to you, but your question around is the data you presented, I think is specific to Imran, based on desktop exercise or mass vaccination sites that are already operational in low and middle income countries. Imran, sorry, I'm trying to track the chat, but maybe you could respond directly, and then we could also open up the floor to Dr. Anand.
Yeah, thank you. Yes, Dr. Anand, on I didn't present the data. The one I gave the sample is when if any partner or organization wants, or the government wants to plan a mass vaccination sites, they have to plan how many vaccinations they can do per hour, per person, and how many vaccinators will be there. So it is for the planning purposes only, is a sample sheet. That if for example, government say, oh, we want to do 2,000 vaccinations per day per site. So then you have to break it down that, okay, for 2,000, how many vaccines will be required, how much time will be required, and whether it's feasible or not. So there are some countries who are doing like 1,000. Okay, in the developed countries, they are doing 1,000, 2,000 people per day, or even up to 3,000 or 4,000 people per day, depending on the resources, depending on the vaccine, depending on the people. Because even if the country establish a maximum centers and people are not coming, you will not be able to do the vaccinations. So the demand from the community is very much important. There's also a question and a comment from a colleague from Nigeria about Lagos, that the experience is that they don't go for the health centers. Yes, we have seen in particular, but I think we need to see Lagos, because Lagos is a very commercialized city and everyone works there. So if the sites are only open in the morning, health centers are open in the morning when the people are working, they will not go there. So that's why for the matching centers, we suggested that at least it should have a second evening shift also. So people can go to the health center to get the vaccine after office or after their business hours. So that is important for that one. Second thing, there's also a question that outside other ones, yes, for other activities, we can do like outreach those, but for vaccines, you need a cold chain, you need a safety of injection practices. So it has to be in a well place where you can provide all those things, because if giving injection will give the infection to anyone and people get any AFI, which is we got adverse events following immunization, it will create rumors in the communities and it will create a mistrust. So safety of injection is very important for injections, for anything which is we are giving to that one, and the cold chain to keep vaccines in a proper conditions. There's another related questions from Jomoko on the mobile. Yes, mobile is also one of the delivery strategies. And as I mentioned, it's not one shoe fits all, depending on the area. Normally in the rural areas, governments are considering the mobile strategies. So they are the different strategies which should be part of the national plan. Over.
Fantastic. Thanks, Imran. And you covered off on all the other questions. I don't know if Dr. Schenker, if you wanted to speak for a moment. It seems like you've also done a lot of work in mass vaccination sites, so would love to open the floor for any of your reflections.
Thank you. Very quick interventions. I think, Imran, that has been very helpful, and our experience has shown that actually, as you have said so correctly, there is no one fit for everything. And our experience had shown actually that a lot depends not only on the good training of the vaccinators. Not all of them are able to pull from one vial 6 doses. And if they do not, that changes the whole calculation that you have just demonstrated. And so it's not just one element of training, but it's also the question of which type of a vaccine. If people are invited for a second dose, there is great reduction, and one needs to calculate for that. There is the issue, as you've mentioned correctly, of kind of drive-in. Well, if people are communicating by TikToks or by tuk-tuks or by Tatas or by combis, basically mass vaccination center next to a taxi rank would be perhaps more applicable, something that we have been actually struggling with and found some great solutions in different projects that we have done similar in concept, and that was around medical male circumcision, where you have established circumcision clinics outside of hospitals, not to take away operating rooms, and you need to ask yourself, where is it best to develop such community centers for another pandemic prevention, that was HIV. So in a nutshell, a lot of considerations that need to be taken, which I think come back to some of the comments in the chat, both this week and last week. That is perhaps to really broaden the consultation with those who have direct experience in setting up different new facilities for communities in low middle income countries, which I think is the concern of all of us. And at the same time, also relying on the fact that the dynamics are requiring perhaps the development of a guide. So I think that your slides, both this week and last week, are a great prompter and starter for such an initiative, for which Impact Vaccination will be thrilled to support. We are already assisting several sub-national organizations, both governmental and others, in developing their proposals for the CDS mechanism. Thank you.
Wonderful. Thank you, Dr. Schenker. And I know we'd love to talk to you more about some of your experiences and perhaps highlight some of the work that you all have done on the ground. I know that we only have about 7 minutes left, and it looks like I think we ticked through most of the questions that were specific kind of to the presentation today. Happy to continue kind of on this same line of thinking. Really, again, as I mentioned in the beginning, wanted to be able to take a broader look at what some of your needs are and where you are. I know we took a couple of polls to understand, 60% of you advocated for funding for mass vaccination sites, understanding kind of whether you had executed on a site before or had not. And so wanted to understand, are there, we are trying to kind of develop, adapt different tools to make your lives easier to get you to where you want to be. And just wanted to see if there were any reflection points, requests, needs that are immediate or medium term that folks wanted to talk a little bit more about. I know we have some discussion questions up on the slide right now. Happy to tick through those, but also wanted to kind of broaden our last few minutes together to see if anyone had reflection points. Imran, please.
Yeah, Jen, just a quick message to the colleagues, because I've seen in the initial, the majority of the colleagues in the today's is from the CSOs and the subnational level. One suggestion to them that in every country, they have a national plans and the national ones. So kindly, wherever you are working in your state, and I see majority, I think a lot of from Nigeria. So if you are in the LGA level or the state level, please be in touch with your state level or LGA level Ministry of Health and the partners and discuss what is the plan in your state or LGA and how you can help them in establishing your mass vaccination centers and what support can be provided. Because it should be, all your work should be part of that national plan or the state or LGA level plans. Over.
Thank you, Imran. And something we heard last week, and I think I hear here today is, that it may be helpful for us to develop a short template presentation that would help you speak to the national level folks to just say, hey, we've ticked the boxes on, we know that it would be appropriate to have a mass vaccination site in our community. We've done some quick financing and budgeting to understand what it would cost. And so we're hoping to put together something simple that would allow you to kind of do your budget and provide that when you speak to your national level folks. So you come prepared with one, we've done the assessment to see, hey, this is appropriate. Or, in the cases where it's not, then it's not. This is mass vaccination sites are, of course, not a silver bullet. But we've done the work to see that this is appropriate here. And then also we have an understanding of what kind of funds we're asking for. So that's something that it seems like would be or could be helpful to kind of pull together on our end in the immediate future. And we'd just love to get reflections if that's the case, either through chat or if you wanted to raise your hand, or if there are other kind of tools or reference points that would be useful. Again, we'll be sharing out everything here today. And I'm even thinking, Imran, from some of the content that you shared, that we can even codify it a little further and make it into a couple of one-pagers, so that folks can easily access and share it with folks above and below you. Thanks, Imran. Any questions, thoughts, reflections? I would really love to hear from kind of the 60% of people that shared that they had advocated for funding around mass vaccination sites. So I don't know if there's anyone that hasn't spoken, but would love to kind of hear that experience. I know we only have 3 minutes left, but great. Okay. All right. Well, with that, I will not force anyone else to speak. This was a fantastic discussion. A huge thank you to, oh, okay, Martha, please go ahead. Martha, did you want to say a few words?
Hello, everyone.
Hi, Martha.
Hello, everyone. Sorry, I came just a couple of minutes ago. It's Dr. Uben. So I work with Martha in the Southwest region, and I'm the coordinator for the expanded program on immunization. So working on COVID-19 vaccination in the Southwest region with Martha. It's a very good opportunity to be here. Now, my question exactly is to know if there's going to be some groundwork on sensitization before creating these mass vaccination sites, because in our setting, the major issue we have is that there is still so much hesitancy on COVID-19 vaccination. So it will really be important for us before we have these mass vaccination sites to really do some groundwork with the various maybe religious bodies, the communities, and have this opportunity to talk to them about the importance of COVID-19 vaccination once more before setting up, because we could still end up setting up the mass vaccination site and then we have no one coming because no prior sensitization had been done before. Thank you, and over.
Thank you. And such an important point. I think if we don't have the demand and we set this up, of course, there would be real challenges in executing on having a good patient flow at the mass vaccination site. I don't know if Imran or Ula, if you have any reflection points, but a really important question. And I think related to mass vaccination sites and kind of mass vaccination campaigns, and understanding how we need to undertake those alongside the setup of a large site. But Ula, Imran, I know we only have a minute left, but just any reflection points on that?
Jen, yes, that's a very important question, because without the demand creation, we cannot do the vaccinations. Even everything will fail. So that is work is ongoing in many countries, but still there are challenges because there's a lot of rumors and a lot of mistrust among the people. So this is a work to even a CSOs who does not want to establish the maximum centers. They can help the government and the partners in creating the awareness and the demand within the communities. So that will be their contribution. When I say public-private partnerships, they can do their role also, who cannot establish centers, but they can help using their social mobilizers or other workers in creating the demand within the public. But this is really important, and without that, one things cannot work. Over.
Great, thank you so much. And I know we're at time now. Just a quick run through of highlighting what we highlighted earlier. Please join us on the boostcommunity.org on the in our learning group that's focused on mass vaccination site in our collaborative. Visit our new website, globalmassvaccination.com, where you can access different resources and information about setting up a mass vaccination site. We will be back in touch, certainly with all the materials we've had here today, and with more resources for you that are tailored. Please join us again. We're going to have these types of conversations every other week. So this is the first of many to come. And then on those off weeks, so next Friday, and then the in-between Fridays, we're going to be doing larger sessions that focus on highlighting folks that have set up mass vaccination sites in their own country. So look out for more information on that. Thank you again, everyone, for joining us. And if you have time to take our survey, please do. Have a great rest of your day.
Thank you, everyone.
Thank you. Goodbye.